All right, let's turn now to the pandemic and the rising number of cases that we see as the vaccine rollout begins now slowly below certainly what we heard from some health officials. But what might it look like as we get into 2021? Joining us now for that conversation is Dr. Ali Mokdad. He is the president or the professor, excuse me, of health metrics sciences at the Institute for Health Metrics and Evaluation, IHME. Dr. Mokdad, we've unfortunately become very familiar with the IHME models this year. And I'd like to begin with some of the latest projections that you guys have put out with respect to when deaths may peak, when cases may peak, and how constructive or concerned are you on the initial stages that we've seen with the vaccine rollout, certainly missing some of those targets set out by the administration just a few months ago?
Good morning. Yes, we have our new projections for April 1st, about 567,000 deaths cumulative from the beginning till April 1st. And yes, we're concerned about the rollout of the vaccine, but remember that there is some catch up, so people have received their vaccine but haven't been reported. And remember also that the first phase of the vaccine, there are people that we need to go out to them to vaccinate them, people in the nursing homes and so forth. But once we have vaccines for everybody and we ask everybody to come in, we expect the vaccination to go faster. If you remember, we give about 3 million doses of flu every year per day. So it's possible that we can vaccinate about 3 million per day or up to 6 million per day if the vaccines are available.
When you talk about the death count and the case count, Dr. Mokdad, is that presumably that's assuming nothing changes? In other words, people are obeying social distancing and masking rules just as they are now or are not right now. In other words, is there anything that could significantly change that trajectory between now and April?
Yes, we assume that mobility remains as is. We project a little bit of variation into the future, mask wearing and of course testing. But yes, lots of things could change. Part of it, people could of course increase mask wearing when they go outside their homes, one. Two, the government could impose some mandates or dial back some of the relaxation of the mandates that they have. So lots of things are possible to change. And of course, we can change the numbers and we can bring them down.
And unfortunately, they could potentially go in the opposite direction as well, presumably. To ask another question about the vaccines as well, Dr. Anthony Fauci recently got some news, some headlines, when he talked about his changing conception of what would require herd immunity. What percentage of the population would need to be either immunized or have immunity from having had the coronavirus? How are you thinking about that percentage? What do you think the correct percentage is? And when are you forecasting that we get there?
You know, it's very hard to get that percentage because, as you know, this is a new disease. We don't know anything about it. So we're looking at similar viruses and how much it will take to get herd immunity. So if you look at measles, for example, it's 90%. But measles is more contagious than COVID-19. So somewhere between 80% to 90% will be very comfortable. We're assuming that about 80 or 90% of Americans, between 80 and 90% of Americans will get vaccinated sometimes by June, end of June. Again, it all depends on the availability of the vaccines. It all depends on no side effects, major side effects, that the anti-vaccines will use it in order to scare people away from the vaccine. So a lot of things need to go right for us to vaccinate the Americans by mid-year 2021.
Now, Doctor, we're in the middle of this current pandemic, so we need to first get this one solved. But I was watching a talk that you gave last year, and thinking about your career at the CDC, and you've studied pandemics, and now one is here. And I think as a concerned citizen, I am worried about the next pandemic. Was this the big one? What are things that we can do in the future? And how do you think the COVID pandemic has changed our public health understanding of what can and needs to be done to prevent these sorts of events from happening?
We learned a lot of lessons, unfortunately, with COVID-19. What we need to do in the United States mainly is to be more active working with other countries in order to detect something as early as possible elsewhere and prevented from getting on a plane and coming here. That's one. So we need to invest in early disease detection and make sure that we train a cadre of people in every country in the world. CDC used to do that and still does that, a field epi training program to make sure that we can catch a disease anywhere as soon as possible and prevent it from coming here. As far as the United States, we need to be better prepared, have a plan for pandemics, roll it out, have a plan for vaccination, distribution of medication, essential supplies to be ready in order to educate our public. But the most important part that we learned through this pandemic is the health of our nation depend on the health of the weakest among ourselves. If you remember, essential workers, we had to shut down some businesses because we were not able to protect them. We need to remember that we need to take care of our own as well here to make sure we can address a second pandemic if it happens as soon as possible.
All right, Dr. Ali Mokdad, the professor of health metrics and sciences at the Institute for Health Metrics and Evaluation. Doctor, thank you so much for joining the program this morning. Have a great new year.
Thank you.